We know our providers are busy. They're working long hours, they're having long patient panels, and at the end of the day, at the very core of what they're doing, they want what's best for their patients. But in contrast, we also know that there is an increasing amount of mistrust that our patients have, maybe not so much with us as providers, but with the system overall. And the questions that are at the very core of the Ask Me 5 are here to help our providers build that trust and keep it going throughout the course of that pregnancy, throughout the course of that postpartum journey. 84% of maternal deaths in our state would identify it as being preventable. That's not an insignificant statistic, it's a huge number. And Ask Me 5 is a source of tools that our providers can use to be able to better identify and recognize key issues that are actually impacting why moms are dying during the course of pregnancy or postpartum.
You know, a lot of these questions are very sensitive. And again, there can be a lot of feelings of distrust and shame and fear and a host of other things and emotions that come along with disclosing that, yes, I am struggling with a mental health issue, or yes, I do have a substance use problem, but I'm scared to death that if I say something about it, my child's gonna get taken from me, or you're going to shame me and blame me instead of helping me. But those disclosures don't necessarily happen on your first visit, right? So every time you meet with a patient, it's an important thought to have some of those questions in mind and to keep that dialogue open. You know, they may not be willing to disclose it now, but you may see the signs. And so they may not give you that answer up front, but if you continue and you prove that trustworthy relationship and that ability to form that trusting bond with them, they will eventually most likely disclose that to you, or they will give you somewhere where you can have a lead into saying, here's some resources that would be beneficial for you.
We know from what our patients have been telling us, a lot of it is just based on how that interaction proceeds. We know that more than 90% of that communication is actually happening in a non-verbal manner. So right from when you're entering the room, maintaining eye contact, actively listening, being direct, being forthright, and really being able to deliver personalized care. It's really not a one-size-fits-all kind of a paradigm, but understanding where our patients are coming from and how can we meet them where they're at. And making sure our patients realize that we're all a part of the same team. We're on their team, and we're here to do what's best for their pregnancies, and so that we can make sure they have the best outcome for the moms and for the babies.
And what I know from being a nurse all these years is that there are a lot of really good people who care a lot about the people that they serve, and they're working in this healthcare industry, and they want the best for everybody they serve.
And what I would say to every provider out there is that if you want to be a part of this process, part of this change to impact the lives of moms and babies across Missouri, use the Ask Me 5.